Assalamu alaikum, dear viewers. Dr. Asnani here. I'm back with another of my video talks, and this time the talk is more about healthcare activism than it is about public support or public education. As you can tell from the title of this talk, I'm not happy with the way World Health Organization handled the COVID-19 spread and this outbreak. So I'm going to try to explain why I feel that way, and hopefully you will agree with me. Now I want to clarify here that I know President Trump said something like that as well a couple of weeks ago. I'm not inspired by what he said, because I had reached this conclusion a few weeks or almost a month before he said anything about it, and that you will understand when I make this presentation. Now, if I pose a question to an epidemiologist or a group of ID specialists, infectious disease specialists, or even people who know what infectious disease spread involves, and if I ask them what is one important thing to do to prevent its spread, or to prevent it from a situation of isolated cases in a certain neighborhood to spread out of that area and become a pandemic or an epidemic, the answer would be we have to contain the spread. So it's simple logic, and it's very simple basic element of epidemiology, that if we are dealing with an infectious disease and we want to prevent its spread, we have to contain it. There are a few ways to contain it, and you have heard of quarantine. Many of you now know what a lockdown is. So there are methods to contain the disease. But before we do that, the most important thing is to contain it at the site, not containing it where it has spread or where it is likely to spread. That's important as well. But we have to first contain it at its site. And that is exactly where the World Health Organization was unable to lead the world. In fact, in certain manner, it proved it restrained many countries from making that decision that would have helped to contain the disease where it was happening or where it started. Now, in this slide, I'll go through historical information about how the disease spread and how China, World Health Organization, and other major countries handled it. So by late December or very early January, we knew that an infectious disease outbreak is happening in Wuhan, China. On January 3rd, there were already 121 confirmed cases of new coronavirus infection, with about 9% of them being in a critical state. So we knew that the disease is spreading. We also knew that it is pretty serious disease, because 9% of cases were in a critical state. So that was enough to raise the alarm. So we had a situation, and we knew it has to be monitored. After about 10 days, there was a report of first case of COVID-19 outside of China. That's when I personally became very concerned about it, and I started following it, and I started reading about it, and I also started putting together a talk like this one because I was concerned about it. On January 13th, by January 23rd, over a period of 20 days from January 3rd, the disease had spread enough that China decided to implement a lockdown for Wuhan and a few other cities in that province that affected a total of 56 million people. And what many of us don't realize, we think it's one country, so there were a few cities that were put down in a lockdown, but we don't realize the extent of the population. 56 million people is a lot of people. So it was a lot of population, a big area of China that was put under lockdown. To understand it, take an example of the population of Italy, where it's 60 million. France is close to 65 million. The UK is also about 65 or 66 million. So we're talking about China putting a full population of the size of a big country in a lockdown. And that was a serious warning. That was a serious red flag. And as I said, I was already concerned about it quite a bit. And that's why I had already uploaded a video explaining about this, the new coronavirus, putting it in perspective in terms of SARS and influenza, and offering guidance on some basic preventive and safety measures like hand washing, keeping distance, wearing a mask, and stuff like that. And that video is still available on YouTube. So I had already put the video up, and it's in Urdu. It's not in English. I made it for my colleagues in Pakistan, for Pakistanis. So that is what, by January 23rd, a full country-sized population was put under a lockdown within China. But how WHO perceived it, the very next day it came out with a statement saying there was no evidence of the virus spreading between humans outside of China. This statement really didn't make sense to me, because we knew it's a disease that is spreading from humans to humans. There were already a few thousand documented cases of the disease at that time, or probably in tens of thousands at that time. There had been some casualties from it as well. By that time, like I recall it because I know when I put my talk together, we knew that at that time the fatality rate was around 1%, which would be 10 times higher than common flu fatality rates. And so we knew it's a fatal disease. We knew it's spreading from humans to human. We knew its rate of reproduction, R zero value, was higher, much higher than influenza. We knew all those aspects. A full country-sized population was put under a lockdown in China, but WHO was more worried about whether it was transmitting between humans outside China or not. Of course, if the people are infected outside China, it will get transmitted. It's an infectious disease. By January 30th, there were 304 reported deaths from COVID-19, and there were over 14,000 reported infections at the time in China, and there were several other cases outside of China. But on the same day, World Health Organization came out and said it did not recommend any travel or trade restrictions based on the current information available. This is a statement that, in my view, was very unnecessary. Not only this statement was unnecessary, it just showed how far behind World Health Organization was. And I don't want to repeat it again, but by that time, a full week before then, a good-sized, country-sized population was already put under lockdown. There were tens of thousands of infections from reported cases from across the globe, and WHO was saying, we don't see a reason that why there should be any travel bans. This statement, because the world was, well, we need to understand that the World Health Organization is the world leading organization on such matters. And countries like Canada, USA, UK, France, they have their expertise. They they were probably looking into all this as well. But when the global leader on this topic comes out and says, we don't see a reason why countries should be putting any travel restrictions. Trade is separate, like the travel is for public. So firstly, World Health Organization combined these two. And then why would it say that there is no need for it? So it sort of made countries to step back, because I'm sure they were thinking World Health Organization knows what it is saying. But anyway, after one day, Italy said, no, we have to put a ban. So they banned, and then a few days later, USA banned. And then a couple of weeks later, USA also banned from 26 flights from 26 European nations. And I believe USA was also way behind the curve on that, because of the things I explain in the next slide. So now in this slide, I'll try to put all that into numbers. So what happens in an infectious disease outbreak is that it spreads. And how fast it spreads depends upon how quickly the virus can reproduce from one human to other humans, and how many humans can get infected from one human. And we call it R0 in epidemiology. So the higher it is, the rapidly it spreads. And it basically accelerates in an exponential manner. So now just imagine yourself riding a big vehicle. And this vehicle is the world. And there are over 120 passengers sitting in it. And the World Health Organization is sitting at the driver's seat. So in such situations, the role of the driver is to have the vision to see a cliff down the road. So they have to have that ability to see way ahead. Passengers, it's not passengers' responsibility to keep looking far ahead. It's that the driver, the expert in the scenario, and that would be World Health Organization. Also, the driver has to keep in mind that the accelerator is no longer in his or her control. The disease is going to spread based on its R0 value and how much people intermingle with each other. So it's going to speed up, and it's going to keep accelerating, and the longer the driver waits, the faster the vehicle will be. So WHO basically missed on all these. It missed on the vision, and it missed on efficiency to apply the brakes. These are data that I gathered from website, and the most frequent website I used was statista.com. But I went on Google. I tried to figure out the travel passengers that travel between countries. And I was primarily interested in seeing how many people were leaving from China to other countries, with specific focus on the countries listed in this chart. I was interested in Pakistan as well, but I couldn't get reliable data on it. And this chart shows the weekly travelers from China to those countries. So for Western Europe, in a week's time, 120,000 people from China come to Europe, Western Europe. In a week's time, 70,000 people come from China to US. From Western Europe to US, the weekly number is 250,000. So from China, almost 120,000 people are coming from China to Western Europe every week, and then 250,000 people from Western Europe are coming to the US every week. And from China to Canada is 15,000 per week, and from China to India is about 1/20th of Western Europe, around 6,000 per week. So there were hundreds of thousands of people leaving China at the time when COVID-19 was spreading within China, and the World Health Organization was more worried about data on how rapidly the disease whether disease was spreading between humans outside China or not, with no attention to the fact that there are so many people leaving China and going to other countries. Now, if we want to put these travel numbers and mix them up with the R0 value of COVID-19, and in this graph I've averaged it to 2.5, it's somewhere between 2 and 3 based on what we know so far, and based on what we knew about a month ago, it was close to 2. Now it's closer to 3, so I put it, I'm using the value of 2.5, so R0 2.5, and I'm calculating the cycle based on 10 days. So at the start of the infection until December 25th, if there was 1 out of every 1,000 passengers coming from China to another country, if there was 1 out of 1,000 chance that that person was carrying COVID-19, on December 19, on December 25th, the week of December 25th, 120 people would be entering Western Europe that week who would be carrying the virus. And 120 is not a big number, but that is the starting number at the ratio of 1:1,000. Because as I mentioned early on, that the disease spread rate speeds up as if we don't contain it. So if we keep that R0 value of 2.5, by this January 24th, in the week of January 24th, there would be close to 2,000 people who potentially were carriers of the virus and entered Western Europe. And for the USA, again, in the first week of, if we talk about December 25th as the initial week, that week only 70 people would have entered with these numbers. But by January 24th, over 1,000 people would have entered USA who would be carrying the virus. And then USA was also getting people from Europe, so those will be additional, and that's a big number, depending, considering the number of people that travel from Western Europe to the States. Now, I put India in there as well, just to show that one of the reasons that we see this big distribution, that in some countries the cases are in hundreds of thousands, in other countries there are still 10,000 or 5,000 or 20,000, and that's because the initial entry numbers were low because of the huge difference in terms of the travel from China to those countries. So the difference between India and Western Europe travel from China is 20 times. So that set the stage. But now coming back to the point I was making, so even if World Health Organization did not have the ability to make the right judgment on its own, China put Wuhan city and 56 million people under lockdown on January 23rd. So even if World Health Organization had not come out with that destructive statement, and instead had said, now that we know that it's spreading rapidly and China has already put 56 million people under lockdown, it might be time for other countries to look at travel restrictions. Like it didn't have even to say it that you should put travel restrictions. I'm sure with that positive guidance, many countries would have taken that opportunity and said, okay, we really need to do this. But World Health Organization took exactly the opposite route and said there was no reason, no evidence to show that there should be travel or trade restrictions. Now, if if these three countries listed here that I'm showing in this table, if World Health Organization had made a productive statement instead of a destructive statement on January 23rd or 24th, whenever it made it, there were theoretically less than 2,000 cases who had entered Europe from China, potentially infected cases at that time. Just in the next 10 days, close to 5,000 cases entered Europe. Now, these numbers are just to reflect that how math works. These are hypothetical numbers, but the ratio is the same. So one can argue, no, the case is, why did I start with 1:1,000? Why didn't I start with 1:10,000? Okay, if it was 1:10,000, the ratio still will stay same. And so instead of 1872 and 4680, it will be 187 and 468. But my point here is to explain the gravity of the situation. That the World Health Organization was supposed to guide us to contain the disease. Instead, it was lazy, or it didn't have the expertise, or I don't know what was the reason, but it failed on doing that. I strongly feel that any organization that is supposed to lead us with regards to matters of health needs to be held accountable if they fail. And it's not about World Health Organization. It can be a provincial government or a federal government or a national level policy or an institutional policy. That's what health activism is. That we want to make sure that we get the best care with regards to health. We get the best protection against the diseases. On this particular matter, with regards to COVID-19, in my view, the World Health Organization not only was unable to lead us, in some situation, it misled the whole world. Now, I'll end my talk here, and I hope you liked it, and please share with others, because we want to get this message out if you agree with it. Thank you very much. Bye.